Good afternoon, Miss Brown. My name is Shiba. I'm going to be your student nurse today. What brings you here today?
Hi, good afternoon. Well, I fell and I have a hip fracture, so the doctor says I need to do a hip replacement surgery. So I would like to know what to expect about pain management and how I will perform my ADLs and just move around after the surgery overall.
Okay, that is very good that you came in today before surgery to get teaching because then you'll have a better understanding of your expectations after recovery. And I'm going to provide you with the necessary resources that will help you go through this challenging time, okay?
Okay.
So before we start, Miss Brown, please tell me your preferred learning style.
Okay, I do learn from like auditory demonstrations and as well as visuals as well.
Okay, so if I may ask, have you ever been admitted to hospital or do you have any chronic diseases such as diabetes or hypertension? Because these conditions need to be stable to initiate surgery.
Thank God I don't have any of those conditions and
Okay.
I've never been hospitalized.
Okay, Miss Brown, do you know anything about hip fractures?
Um, I think I remember the doctor saying like injuring the intertrochanter and the subcapital part of the hip.
That is very true, and it refers to proximal third of the femur, and mostly affects people older than 65 years old. And 70% of hip fractures are a result of osteoporosis. Do you know if you have osteoporosis?
No, I don't have osteoporosis, or not that I'm aware of.
Okay, you should maybe get that checked with your family doctor after, okay? It is very good that you know, okay? So do you have any previous experience with this type of health challenge or any other health challenge?
No.
Okay. How do you see this current health challenge?
Well, it's a very big change for me because I usually do everything on my own, and now I can't do much because I know may need help to do simple everyday activities like going to the washroom even and getting in and out of bed and things that I was fully capable of doing before this.
I do understand, Miss Brown. It's a big challenge, but the sooner you start rehab, the better. Ambulation usually begins first post-operative day with supervision of the physiotherapist, with actively assisted exercise as tolerated. I'm sure with the proper support, you'll be able to do much more on your own. Some patients do go home after a broken hip surgery, but others may need to go to rehab on a nursing home for a few weeks, usually about a maximum of 90 days, until they are strong enough to go home. The good news is that you'll have the support that you need when you leave hospital. Do you have any questions for now?
Yes. What are some of the things which I probably need to know?
Okay, you mentioned about the pain management, so it's very good that you brought that up. So in the event that you're experiencing pain or swelling, use an ice pack of frozen peas wrapped in the towel, but never put them directly onto your skin, and never leave them for more than 10 to 15 minutes. Place your leg on pillows to help with swelling. Large pillows should also be placed between the legs. Avoid hip flexation. Hip flexation will be something like this, okay? Always frequently wiggle your toes to help with blood flow. Turn on the side approved by the surgeon. With healing, the doctor may prescribe compression stockings. It is importantly to remember to wash your hands before touching the wound to avoid infection. If I may ask, Miss Brown, do you know how long you have to wash your hands for?
I'm not sure. I usually just wash my hands.
Okay, it's about 15 seconds.
Okay, good to know.
Yeah, position in proper alignment to reduce pressure on nerves and tissue. In addition, you should collaborate with a physiotherapist and nurse in developing and executing an exercise program to promote continuity of exercise. You should sit at the side of the bed first to facilitate posture adjustment. Use an elevated toilet seat with adjustable safety rails while maintaining proper body alignment. Correctly use a walker or crutch to transfer from bed to chair. To go up the stairs, you put your non-operated leg up first, then with the cane and handrail step up, then bring your leg up. To go down the stairs, bring the cane and your operated leg down first, step down with your non-operated leg. Okay. Use a long shoe horn to put on your shoes. Do you know a shoe horn?
Yes.
Okay. Okay, that's very good that you do. Place the chair inside the shower or tub while washing. Do not cross your legs. Do not force your hip into adduction or internal rotation. So that would be something like this, where you have to have your hip do this, right?
That's the which one is that one?
The hip internal rotation.
Oh, okay, that's the internal.
Exactly, yes. Do not force your hip at a degree more than 90 degrees. Flexation. You must notify the doctor if measures of pain relief are unsuccessful or if current pain has significantly changed. You should express intense discomfort regarding activity. So, in case you're walking and you feel extremely pain, you should talk to your doctor. Okay. Do you have any questions?
Are there any complications which I may encounter?
Oh yeah, you could. There may be complications as a result of surgery, such as infection. That's why it's very important for you to wash your hands before you touch your wound. There could be bleeding, problems with wound healing and blood clots, shortening of the affected limb, or dislocation, degenerative arthritis. But you shouldn't worry about this because in case you have pain, the doctor will prescribe for you pain medication like analgesics. In case you have an infection, the doctor may prescribe for you antibiotics. He may also prescribe calcium and vitamin D supplements. In case there is clotting. To avoid clotting issues, he might prescribe for you blood thinner like aspirin. So yeah, you shouldn't worry about those. Okay. Do you have any questions about like what I just talked about?
Not really.
Okay. Could you tell me some of the things you should avoid doing?
Oh, I should avoid. I think you call it turning the hips in internal rotation.
Exactly.
Yeah, and I should use pillows when turning in bed.
Yeah.
And I should use the help of a walker when going up and down the stairs and so forth.
Okay, I can see you've learned, and that's very good.
Okay,
there are also some follow-up care that you have to do. Do you know what follow-up care is?
Not quite.
So those are the follow-up. Those are the visits you have to do, and I'll explain more about them. So the doctor may ask you to make visits to the office to check on your progress. He might order an X-ray to make sure your bone is healing normally. If you have staples or sutures, your doctor will often want to have them taken out 1 to 2 weeks. You'll need to continue physiotherapy. It's very important that you do physiotherapy because it will help you regain strength and fully use your hip. A radiography will be done to determine how much weight bearing is possible. If you're on drugs to thin your blood, you may need a special blood test so often to make sure the blood thinner is working. And it is very, very important that you keep these appointments. Okay, Ms. Brown?
Okay, thank you.
Yeah, it is also very important to keep you and your environment safe because once you have a hip fracture, there is a possibility that you may encounter a fall. So it is very important that you keep your environment secure and with use of non-slip rugs. You can also use an external hip protector, which is a very good idea. Okay. Any questions you have for me?
No, I have no questions.
Okay.
Just trying to process everything. Very
Okay.
informative.
Okay, so if you have any questions after here, you can always call the office and request for me or any other nurse to see you. And I also have procures for you. I've also mapped which websites you can visit for more information, and I've made an appointment for you to see the physiotherapist to give you more insight on the ambulation, the exercise you might need to do. So the reception will give you more details on that.
Awesome. Thank you so much, and thanks for the information.
You're most welcome.
Thank you.